Hey, good afternoon, Teresa. How are you today?
I'm great. How are you?
Doing really good. You've had a busy schedule here recently, just getting back in town for some stuff.
Yeah.
How's everything been? Feels like it's been a while.
Oh my gosh, it's been busy, but so good. When I say busy, I mean I like being busy. I don't mind being busy. Busy doesn't have to be a bad thing. I think it's not a negative thing if it
That's awesome.
leads to good things. And I had lots of learning. I went to a conference about longevity, which I learned some really awesome information from some really smart people.
That's great. No, anti-aging, longevity. I mean, everybody wants to live longer and figure out how to prevent early death. Lyme disease is what we're going to be talking about today. And I know you also have another conference coming up that you're going to be going out of town for the remainder of this week. So appreciate you hopping on and doing the video. And I'm sure we could figure out some ways to improve our lifespan when it comes to living with Lyme disease. uh,
Yeah.
Something my wife suffered with, and I did, and it's a nasty one.
I tell you, the very first thing, the very best and first piece of advice I always, you know, want to give people is Lyme disease can be a chronic thing. It can be something that hangs around for a while, but it doesn't have to become our identity. Just
Mhm.
like being diabetic, you know, I don't have to identify, hi, my name is Teresa, I'm a diabetic. You know, hi, my name is Teresa, I have autoimmune. Hi, my name is Teresa, I have Lyme. Are those all things true? Well, no, I'm not diabetic, but I have autoimmune. I have had Lyme disease. That
Mhm.
is not who I am. It's really challenging when it comes to any chronic illness, things that hang around for longer than, acute. The difference between acute and chronic is the duration of time that they stick around.
Right.
When we think acute, we think, well, probably gone in a month, but chronic could be months to years. And when we live with something that really impacts our health, like Lyme disease does, it's really hard to not have that become who we are. And so, but when we can separate the thing, whatever that thing is, from who we are and how we identify ourselves, that's actually the first really big step in being able to move forward and progress in our wellness journey.
Such a great point because I think it's really easy to identify with something, especially when you've been battling in health for so long that you don't know the end doesn't look like it's in sight. It's just this long journey that you've been struggling trying to find answers. And it was that way for my wife, but I think there is other variables, and like I believe for other people as well, there's always other variables. It's never just one thing these days anymore. It's probably never just two things either. It's multiple. And Lyme disease was part of the picture there, but why is Lyme hanging around in this chronic way? And I think there's a lot of reasons for that that we can talk about, but a lot of people, I think, also believe that you have to live in what we call an endemic region of Lyme. And the Northeast, you don't really have to. Um, it ticks are everywhere. I'm down in the South in Texas, and you're in Pennsylvania, and I'm sure you have ticks. I have ticks. They're different species, meaning they're going to carry different uh, types of bacteria and different nasty stuff that can be transmitted through one bite to us. But depending on who you read and what you read, mosquito bites, dust mites, there's ants. There's so many weird things that can transmit stuff into us. This is, how well is our immune system, honestly,
Yeah. Yeah,
and
for
how full is
sure.
our bucket?
Yeah, no, I think, well, you said a couple things that I had comments on. The first thing is it's a misnomer to think that it is only ticks, right?
Mhm.
That's what people used to think. That's what a lot of people still think, except that by nature of what a tick is, it's a parasite, right? It attaches itself to you, it draws blood from you, so therefore it brings something out with you, and so it can give something back to you through the blood. Lots of other things do that. Flies, ants, mosquitoes especially, like they do the same thing. So it's kind of silly to think that we can limit, tick-borne disease, or some people even will say vector-borne disease, meaning a vector is I carry this thing from this thing. I pick up this disease over here on this person and I carry it over and I give it to this person over here. It's a vector. I took it with me and dropped it down somewhere else. And so when we call it tick-borne disease, we limit it to being a tick only that
Right.
can do that. But if we call it a vector, then that's where we can add in the fly, the mosquitoes, things like that. So super important to think that, or, to kind of like have that shift where we realize, and, as you said, it used to be Borrelia burgdorferi was really endemic to the northeast where I do live in Pennsylvania,
Hmm.
except that Borrelia is different. Like Borrelia aurantia got its name because it's from the Orient or the Asia, the Asian area. And with we live in a very small world. As I travel to Austin, travel to, Florida, I've, traveled a couple months ago to Alaska and a couple months before that to New Zealand, right? We live in a very small world. People are all over coming, so, and even flies and things like that travel in the airplanes,
Right.
and come out and land somewhere else. So that's how we get things coming from one area to the other.
Hmm.
So those are the two things. And then the other thing is, why does Lyme hang around? So the reason Lyme, as opposed to some other bacteria, hang around, because it is a bacteria, is because of its shape, the kind of bacteria that it is. It's shaped kind of like a corkscrew. It can like really squirrel its way into pockets, small pockets. So the places it loves to live are things like joint spaces, knees, shoulders, elbows, can live in the vertebra, some
Hands,
teeth.
shoulders, knees, and toes.
Exactly. Head, shoulders, knees, and toes, right? It loves to live underneath teeth. Unfortunately, we have, um, a lot of people have, spaces under their teeth where they've had, cavities and or root canals or teeth taken out, where the Borrelia like to pocket in, and they kind of hole in that little area, and they get stirred up from time to time. I have one, um, two pa- two patients I'm thinking of in particular. They have to be really careful to take certain supplements ahead of time and afterwards every time they go to get their teeth cleaned, because every time they do, it stirs something up. And for the one person, it flares her lupus, the lupus that she has struggled to overcome. Like she says she has that diagnosis, but she doesn't live like that. Like she doesn't, that's not her identity. And then the other little boy, he's actually a teenager now. He just turned 14. He has struggled with, autism and PANS that came from the original Lyme, illness. And every time he gets his teeth cleaned, his OCD and his tics just like go crazy. So we have to be really careful. His parents really work hard with me to give him stuff ahead of time and give him stuff afterwards to kind of like preclude a mess, a big flare up, and then scoop up the mess afterwards, because for him it becomes, a challenge. So that's why Lyme sticks around as long as it does. And I'll just throw this out there. I have worked with lots and lots, hundreds of Lyme patients, maybe not quite 1,000. I don't think yet it's been that many, but hundreds. And it's the very first thing that I mentioned, because Lyme, oftentimes Lyme becomes our identity. There is often an emotional component to what's going on that we have to deal with.
Hmm.
It is absolutely a real thing that we have to deal with. And there are some people that they will only get so far in their physical healing journey. And then it kind of stalls because there's something emotional, some stress, some trauma, something that happened that we have to figure out what it was and help to work with that, because they just kind of like, they're, because of the mind body connection, the way the mind and the body overlap, sometimes we have to just like really focus on the emotional and trauma stuff before we can get the body to move and shift in the right direction, which is actually the conference I'm going to this week, is dealing with that, the
I'm excited to hear
neuro-emotional.
about what you learned about this week too.
Yeah, it's going to be fun.
And if the viewers, our video that we did, gosh, actually, we started talking about stress and hormones, but it kind of spiraled down into, pun intended there, with a spirochete bacteria for Lyme, but it
Yeah.
spiraled into
I'm good. But I'm pumped.
the NET and emotional stuff on emotional trauma
Yeah.
and stress and hormones. And so if you haven't watched that video, I encourage you to go back and watch that video because Teresa talks a lot about the mind body connection and just how um, past traumatic events in one's life can keep one stuck, or like you just mentioned, we can plateau and seemingly not get better. Going back to that identity piece around a chronic illness, it doesn't necessarily have to be Lyme, but any type of autoimmunity. Um, there's probably some type of trauma that's undealt with there. And
Yeah.
just,
I was on I have a clinician call that I attend every Tuesday with a group of people that I feel are so much smarter than me. And it's just this collective minds, come together. And they were talking about this new phenomenon called mast cell activation syndrome and how it has an emotional component. And I was like, yes, I knew it. Because I kept saying every time I go and ask, a colleague, boy, I'm struggling to help this person with this. And I really feel like there's something emotional that's keeping them. And I must have talked to like two or three different providers over the last several, like 6 months about this very thing with different patients. And they said it today. And I was like, yes, I knew it. Because there is such our mind is a powerful thing. Okay, so I'm just going to do a little sidetrack real quick. I read a book a long time ago, about this guy who had this sporting accident, and he was in a striker bed, which is what we use in the ICU. It like completely immobilizes the patient. They're all like splayed out, and we had to flip them, and that was his life because he broke his back. And if he didn't remain completely motionless, he would have been paralyzed. He did nothing for 6 months but visualize his back being healed and his spinal cord repairing itself. And he got out of that bed and walked home.
did you
So
mention that was placebo?
it was okay. So that's a whole nother thing, like
Oh,
the
okay. Oh,
placebo, nocebo effect. That's a thing. So that's not what happened.
okay.
He actually, he went on then to create this company where I think he called it, what do you call it? Not mind mapping. That's something else. He came up with this method where he would instruct, became a coach to teach you how to visualize things. Basically, faith is the substance of things hoped for. It was visualizing those things, seeing those things in our mind's eye as the way we want them to be. So when he was lying there, he would see all the different neurons coming together and all the different pieces of bone forming, and every place where it was fractured, healing. And he would visualize that in his mind to where his body began to lay down, all the different proteins and things like that to actually heal his body. They did nothing to him besides that.
Yeah, that Dr. Joe Dispenza was the guy that I was thinking of when you were explaining that. So I
Yeah,
was
it
wondering,
wasn't him, but I love his work because he does a lot of the same thing. He talks a lot
okay,
about the same thing.
that's really cool. Lyme disease. So the quick story, when I was probably 10 or 11, I used to go with my childhood best friend to his grandparents' place up in Oklahoma for 2 weeks during the summertime. And I remember we were playing Back to the Future in this little old broken down car in the summertime that was out in their pasture. It was early afternoon. It was starting to get really hot. We're getting kind of hot in that car. And we got out of the car. I'm walking back. I'm like, man, my leg is just really itchy. And I pull up my right pant leg, and from just above my calf muscle down to my sock line up my ankle was covered in red ticks. I didn't really know what to do. So we went up to his grandmother's house, and she pulled out a Swiss Army knife and just started cutting them all off and scraping them off. Come back home 2 weeks later with a swollen red leg and all nasty looking. And I'm like, Mom, you gotta check this out. Look at my leg. And she like freaks out, takes me to the doctor. They give me antibiotics. They gave me cortisone cream to rub on it. And I really don't remember. I was so young. I don't remember what they gave me, but I don't even know if Lyme was talked about, even though I had mentioned I came home with all these ticks. And I want to say that they diagnosed me as scabies. Anyway, never really thought much about having Lyme disease or any symptoms of Lyme, but I had always struggled with these motor tics and twitches. A lot of people may have Lyme. They may have been bitten by a tick or something that carries Borrelia or a co-infection, um, Babesia or Bartonella or something else, Mycoplasma or what have you. And it goes dormant, and then something activates it, and it kind of flares up. And that's one thing that I feel like a lot of people probably have, just like Epstein-Barr. Many people may have the little bug or the virus or what have you, but it's just, the immune system does a really good job at keeping it at bay.
Mhm.
And something like COVID or a flu or a major traumatic event, a divorce, a death in the family, an
Mhm.
accident can cause a flare up. And we call that your perfect storm,
Right.
that now your bucket has, just spilt over and
Yep.
you're manifesting with these symptoms.
Yeah.
And that narrow textbook definition, I would say, of Lyme is that it's an infectious disease caused by the bacteria that you've already stated, Borrelia burgdorferi. And then it's a spiral shaped, kind of like a corkscrew bacteria called a spirochete that you mentioned. It burrows deep down into tissues. And that's why a lot of people have joint pain. It can migrate from one location to the next, from
Yep.
knees to the elbows to the shoulders. And so if you have that migrating joint pain, maybe think, hey, you might want to do some exploratory testing here that we can talk about. But there's over 300 strains, and I think that's why we're seeing it was over 400,000 new cases per year. This is by the CDC, their own admission of recently, and I bet it's more than that, just because of Lyme being the great masquerader in that it can mimic so many other conditions.
Yeah.
That's too something that we should probably address. But
Yeah.
shifting over into testing, what are some approaches that you take or that you would do to help identify if someone's experiencing these clusters of symptoms that nobody can figure out? Like, how would you go about identifying possible Lyme disease?
Yeah, I actually have, it's funny because I have to go through this little like algorithm in my head just last night because I have a colleague who lives, where I used to practice, and he texted me and he said, "Do you have a minute to talk?" And I said, "Sure." So he called me up. He goes, "I have a friend who's a patient who he's really going through it, and I think this is what's going on." And he told me everything that you just said. And first he went to conventional doctor. They said, "Yes, you have Lyme." Then he went to another doctor. They said, "No, you don't." Then he went back to the other doctor. "No, yes, you do." So he's like, "I don't know what to do." And he's a chiropractor. He said, "I could adjust him and help his nervous system to be able to function, but I can't address what you're doing." Um, so I said, "Well, here's what we do. And this is what I do." Most people coming to me, I am private pay, so I do not take insurance, but I try to use insurance to order testing when possible. So at the very least, the very first thing I do is, either LabCorp or Quest Diagnostics, and I order a whole bunch of things. Their Lyme tests are terrible. They're terrible Lyme tests. So if you show up and you have something that shows up on their test, you got an issue. And I'll explain how the testing works in a minute. But then, so I call those my screens because they are never false positive, but they're all the time false negative, right? They're a much more sensitive test. And I do something called bioenergetic testing, and I am able to screen for Lyme. And if it shows up that I can see it, oftentimes when I draw blood work, it'll be there. So I also do that. But when it comes to like the gold standard, hands down, everybody in all the societies agree that this is the best test. There was only one, and now there's two. The second one just came along recently, and they did everything they needed to do to where their Lyme test is now just as good as the other. So the gold standard is IGeneX.
Mhm.
IGeneX has a whole bunch of different ways to look at it, and there's a whole bunch of different. You could do a PCR. It's just the way that they test, right? You can do a PCR test. You can do a Lyme blot test, which is pretty much the best way to go. PCR, you can use urine, you can use blood. Lyme blot, you have to have blood. That's really the gold standard. And then Vibrant Wellness is the other one. They just came up with almost exactly the same test.
That's what I
So
used for life was the Vibrant Wellness Tick-Borne
yeah,
2.0.
2.0. Yep. So what we're looking for are antibodies. And we've explained this before, but I'll just do it real quickly again. An antibody, so anytime our body gets exposed to something, that's called the antigen. And then our immune system launches an assault because the antigen is the same thing as a foreign invader. So the immune system sees the foreign invader and says, oh my gosh, foreign invader. And there's 5 different kinds of antibodies that can make. If it's a true blue allergy, like I eat peanuts and I blow up with hives, that's an IgE reaction. That's a true allergy. If it's an illness like influenza, Epstein-Barr, like just mono, or strep, something like that, which is a bacteria, the first kind of antibody our body sends to the rescue are these IgMs. I tell everybody, think M, I feel miserable. It's happening right now. I'm acutely ill, right? I feel miserable. It's now. Those are the antibodies that come out right away. Usually within 3 days, they're there, and they can last anywhere from a couple weeks to a couple months, usually not longer than 5. While they're coming up and peaking, then at the same time, about 7 days, our body starts to make IgG antibodies. Think G, it's gone, right? So those are our memory. Those are the ones that peak and kind of go down. They may go away completely, or they may hang around in low number. It's okay because it's our memory. So that if we get exposed to something like the flu and it comes down around and it's the same kind of flu, our body goes, hey, I remember you. I know what to do now. So maybe you get sick, but it's not as bad, or maybe you don't get sick at all. So Lyme is a little bit different. What we're looking at, there's these different levels. I don't know this, for lack of a better word, they're called bands. They're different levels of
Yeah.
areas of a signature that the bacteria produces. And what we're looking at is certain bands and then a certain number of them. So
Mhm.
according to the CDC, to have the official diagnosis of acute Lyme, I have to have 3 or more of the IgM antibodies or 5 or more of the IgG antibodies. That's a positive diagnosis. So when we do the LabCorp testing or the Quest diagnostic testing, they both check for the same number bands, and they always start with a P, P19, I'm sorry, P18, P39, P41, P58. They always check for the same ones, but usually like I said, there's hardly ever a false and positive. There's usually a lot of false negatives. IGeneX does a much better job, and they look for the same things. Then there's the ELISA test, which is a whole different way of doing it, which is reliable as well. And only certain labs do that. So the one that I like is the IGeneX or the Vibrant. And I'll be honest, if I'm going to run a Lyme test, I'm going to check for the other things too. They're called co-infections. They're the other friends that come along for a ride. They hop onto the train and they get on the bus with you. And that's, Bartonella, Babesia, and there's strains of theirs. So,
Mhm.
it could be a Microti, a Ducani, there's different ones that come along of each of those as well. Ehrlichia, Rickettsia, those all come along for the ride. Tick-borne, Rocky Mountain spotted fever. So
Toxoplasma gondii.
if I'm really concerned that somebody has acute Lyme, I usually just say, I know it's a lot, but let's bite the bullet. Let's get the whole thing done. We need to see where we're at. Treatment is
Well, to validate
pretty
that,
similar for all of them, but not necessarily. So, I'm pretty much say, let's just get them all.
and to validate your statement there, Richard Horowitz, who's a Lyme literate medical doctor, who's treated thousands of Lyme patients, probably more than thousands, maybe up to tens of thousands now, but he says that 80% of all of his Lyme patients had at least one co-infection.
Hmm.
And I would be confident to say that co-infections are probably a big reason people don't get completely well, but then becomes activated because of, a chronic Lyme or another co-infection, the
And mold
anaplasma,
goes in that bucket
mycoplasma.
too.
Mold
Mold,
definitely goes in
mold
that bucket,
absolutely goes in that bucket. All
100%.
those things create what we call biofilm,
Hmm.
especially in the gut. Mold creates a big biofilm in the gut, and then bugs love to hide under the biofilm.
All,
So,
and heavy metals
and heavy
and
metals,
parasites.
parasites, all the time.
It's a big convoluted mess, and it's almost like, where do I begin? Where do I start? We always make fun of the which came first, the chicken or the egg, but
Mhm.
Lyme is one of those issues where sometimes you have to stabilize mast cells, which are produced by an overreactive immune system from the Lyme and mold. But in order to get to the Lyme and mold, you might have to treat and stabilize mast cells first before actually addressing the bug itself or the co-infections.
Yep.
And everybody's different. You can take
And
two
then
people
then
with
you throw
Lyme
in
disease,
methylation and all that kind of fun stuff.
genetic susceptibilities, and they have impaired detoxification. And it takes a long time for people to truly overcome it
Yeah.
because there's just so much stuff that you have to work through. And a lot
Yeah.
of times these people have already been to so many doctors. You were mentioning that the Western blot or the standard CDC criteria is very poor. Clinical criteria most of the time is, do they have a bullseye rash called erythema migrans, or do they have at least one manifestation of musculoskeletal or nervous system or cardiovascular, or laboratory confirmations of those protein bands.
Mm-hmm.
And you have to have one before they even consider their two-tier method,
Mm-hmm.
and misdiagnoses of it due to the fact that standard route just doesn't get it done. It doesn't really, it's not
It
adequate.
doesn't, yeah, it doesn't get it done, and I think it's not well understood. I think um, that's more of an issue. Dr. Horowitz is a great one. Dr. Marty Ross has done a really good job too.
Mhm.
And I'll just throw this out there. Like, he wrote a book, but his whole book, if you decided you wanted to download it chapter at a time, every blog that he has on there is a chapter out of his book. And some of the stuff you can do on your own, some you can't, because he is antibiotic, he does have a lot of recommendations for antibiotic use, which I'm not opposed to. Like, I actually, this guy coming to me, and I'm okay, so we haven't talked gut microbiome, I don't think at all, but like, antibiotics are like low on my list of things that I use for most things. However, there is a time and a place. Lyme can be so bad that it can affect your heart. Heart can actually
Yeah.
stop. So there's a time and a place where you want to make sure that you just, if it's because, especially because it gets overlooked, because the tests come back negative, they think, no, it's not there. And I'm like, it looks like a duck, it quacks like a duck. It's a duck, like, this, I read the notes on the doctor who said it wasn't Lyme. And I was like,
Yeah.
did you not? I'm like, okay. So, because I'm like, look at the guy in front of you. Every joint in his body is swollen and he can't move and he's in pain. And it lives in a wooded area.
But
Okay.
if he has a negative ELISA, he has negative for Lyme, and
Yeah.
that's why
Well, he
they keep
did, and
doing
then
the
he
test.
didn't. And then he did,
Oh
like,
man.
so it's like, oh, okay. So anyway, my whole
And I'm
point
only
is,
saying that as playing
he is
advocate.
someone that I might use an antibiotic for. And
Right.
so it was funny because they did give him an antibiotic for 2 weeks, and then they stopped it, and then they started again. And my doctor friend, he was like, why do you think he's not responding? I said, it comes back to what you said about the perfect storm, because he probably had other stuff going on that he was able to manage, and it tipped the bucket too far. Like, it just got to be where it was too much. And now the normal antibiotic that's supposed to work now doesn't even stand a chance, because now you got all this other stuff going on.
Hmm.
And so it's not that it's not working, but all the other things are there too, that's creating just this swirl of, this cytokine storm that everybody loves to talk about since the pandemic, which
Hmm.
which is another, like, I don't want to go down that rabbit hole, but the health of our country over the last couple of years, people are a lot sicker,
Yeah.
and so their tolerance level for things is a lot lower.
Right.
There's a lot more mast cell activation than there was 3 years ago. And people are just a lot sicker than they were 3 years ago. And everybody's buckets are getting, and then don't even talk to me about the air that we breathe and the food and stuff like that. Like, that's a whole, we talked about stuff like that. We can, refer you back to the toxic environments that we live with every day. Um, it just, if we are not careful, we cannot bail our buckets fast enough to
Hmm.
keep up. And the general public, and, my next door neighbor who's a cardiologist, I know does not know this stuff, because that's not how he was taught. That's not how I was taught.
Right.
I sought this stuff out because I warranted it because I was sick.
Hmm.
And most people who are in functional and integrative medicine today are so because they started off in the traditional training and found it lacking, and was like, there has to be more.
So it because a lot of people have already tried some interventions with no result, or maybe perhaps a worsening of their symptoms. And so it's nice to just kind of reset them, new start, new hope, give encouragement and support. maybe decide what labs you want to run and get those started. Um, and then just kind of focus on specific Lyme labs like Vibrant does great. And if you want to catch all of those other, that's what I loved about Vibrant is that they cast a very wide net to bring in some of those co-infections to kind of help you see
They
what
do.
other stuff is there. And, go slow, both at the comfort level of the individual that you're working with. Remove any sources of inflammation. So we always want to remove that source of whatever could be causing inflammation. So speaking dietarily, that's, the gluten, the dairy, the sugar, what have you. And that might be all we focus on at first and make sure that the person truly is having those things eliminated from their diet. And then we can go on to, hey, let's support your detoxification routes. Let's open up some drainage pathways and really make sure that before we start hitting it hard, your body's able to flush what's going to be dumped. Because
That's
if
the
you can't,
very first thing I do.
it's
Very
going to
first
back
thing I
stuff
do.
up.
Yep. When people come to me new, like, they have a big questionnaire and, we talk for an hour and a half and some people are like an hour and a half. And I'm like, you should see some of the questionnaires. And we talk and because I gathering all the information, I'm getting all the background stuff and finding out, have they ever had amalgam fillings? Have they ever lived in a house that the basement flooded? Do they live near cell towers? Do they have they ever traveled abroad? Um, have they ever been bit by a brown recluse? Do they eat farm raised fish? There's lots of things, things like that. So we
How many
talk about
personal
that,
care
and
products
then
would
and
you
then
use?
we ordered what's that?
How many personal care products do you use?
Exactly. Like, and what kind are they?
Yep.
If you can't put them in your mouth, don't put them on your body. I already talked about that. So we do that for like an hour and a half, and then it takes about a month till I have them come back and they have all this test done. But while we're waiting, I start them on a nice, gentle, get your body ready. Some people call it the prep phase. We have to prepare the cells and all the detox pathways. So we're getting the liver ready, we're getting the kidneys ready, we're getting the lymphatic tissue ready, we're getting our cells ready to kind of get things moving so that
Yeah.
when we start to ask it to do something, it's going to respond in a positive way, not a negative way.
And even if we do have what they call a Herx reaction, is that to embrace these symptoms and not just to kind of freak out and then educate people on how and what to expect, how to handle them. And because most people are going to be okay if they know what's going on and
Right.
know that there's a potential for it to happen.
Yeah.
And
Fear is a very dangerous thing.
mhm,
Like if you look at if you're in fear or worry or anxiety, your body can't heal itself. That's why stress and sleep, which goes hand in hand with stress, are also some of the things that we talk about in what we look at. How well are you sleeping? And how well are you moving your bowels? And what's your thought life like? Because you cannot live in fear and expect your body's going to respond in a positive way.
absolutely. And that's, I think, why it's so important to have more holistic and integrative healthcare practitioners like yourself, health coaches like myself, because I think we're in a great position to help these chronically ill, whether it's Lyme or mold or what have you, folks, as we see the whole person and the constellation of symptoms that they may manifest or experience with. Because yeah, of course, we must treat the Lyme, but supporting all our systems while addressing other issues to facilitate that recovery is, I think, of utmost importance.
I
And
literally I've told people a couple times, we're going to stop everything and we're going to go over here and we're going to deal on your emotions. I have a lady right now who has severe mast cell and Lyme. And I said, we're not going to, I don't want you to take another supplement until we deal with this. Because if we don't get you freed up from the trauma that you've gone through, your body's never going to heal itself. And it's funny because she was at the place where she only had like 5 things that she could eat. And she felt horrible all the time. And when I started doing that and I started meeting with her and working with her, she would come back the next week and go, I had like, and we meet Friday nights and she's like, I actually got to go to church on Sunday. I felt good. First it was just she felt good Saturday. Or first it was she felt good Friday night and she slept, which she doesn't sleep or had trouble sleeping. Then I felt good all Saturday. And then it was I felt good Saturday and Sunday. And I'm like, see,
it's
now I
awesome.
can get you to the place where now you can start taking even just a probiotic, something like that.
Yeah, it really does. The reset thing and helping people understand if they've been doing something for so long and it's not working. I mean, what's the definition of insanity? Doing the same thing over and over and expecting a different result.
Yeah, it was
That
Albert
happens a lot.
Einstein. He was really smart.
That it happens a lot in our cases where people just go back to taking supplements thinking that it's going to help, but yet there's some other underlying block. And rather than try to just let me give you this much more of a supplement to get over that hump, let's address and remove that block. And in this case, a lot of times it can be those emotional factors that are just unaddressed because people don't want to open up that can and have to, stir up old wounds. And but oftentimes that's where the liberation comes from, the freedom comes
Yeah,
from. Those is working through it and allowing our body to respond in a different way because we're retraining our brain that you're safe. It's okay. We can heal.
right.
Yes, we have to deal with these things, but we also need to understand how can we tell our subconscious or our body that it's okay today,
Yeah,
and we want to get through this and there is hope, there is light at the end of the tunnel, but we have to be aware of things that occurred in our past. We can't just sweep it under the rug and hope for the best.
right.
We do have to deal with them. And so taking it slow, working with their diet and the lifestyle factors as much as possible, setting their expectations for the duration of it's not a sprint, it's a marathon.
Yeah, for sure. And no, I think sometimes I hear a lot. People tell me a lot. My patients tell me a lot. Just knowing that someone validates them, that they don't feel like they're not being made to feel like they're crazy or that it's all in their head or there's nothing wrong. You know, I just I just I was a person. I was that patient that had normal blood work, but it was not normal. There was lots of things that were wrong. And working in the emergency room, the things that they did manage to diagnose me with when a doctor saw I remember one night I was working and the doctor saw on the chart this lady had this diagnosis and it was something that I struggled with. And he said, "Oh, she's just lazy, stupid, or lazy, crazy, stupid, or drug seeking." And I
God,
was like, "Oh, okay, well, I guess I'm not going to talk about my things with my coworkers. I guess that's not going to ever happen." And I was I was a highly educated person. So, um, it's there's something to be said just to say, to have hear someone say, "I hear you, I understand, I can empathize, we're here for you, we're walking through this with you." Some months are going to be easier than others, but we're in it for the long haul. Sometimes that's worth its weight in gold.
100%. And I do think oftentimes it's hard to find who you can trust and talk to when it comes to doctors, especially the conventional route. But I mean, there's more holistic, integrative people who are like yourself, who've gone through their own health struggles and really know the fight and the battle that we're up against. And so it makes us more appreciative of those other people who had no one to turn to. And I also think too, at the same time, that when we're looking at the duration of a treatment plan for an individual, whether it's 2 years, which can oftentimes be very average for those who struggle with a chronic illness like Lyme and trying to understand these other variables that play into their challenge, there's going to be ups and downs in that, time frame, that it's okay if there's hiccups. It's okay if we fall back a step or two. The most important thing is don't let those setbacks define where you were going forward. Just kind of understand that it was a setback and keep marching forward
A
as
lot of
you
things
treat.
one of the things I love to do, just to that point, I love questionnaires that are graded
Mhm.
because oftentimes we feel that we're not making progress. But if we pull up that questionnaire from a year ago and we go,
Right,
"Look what you were then and look where you are now.
right.
Now do you want to do a happy dance? Woohoo!" Because you may not feel as good as you did. And maybe your score this week or this month is maybe a little bit worse than it was last month, but it's way better than it was a year ago. And that's, always turning it around and focusing on the positive is always going to go a long way to helping us stay hopeful for the future.
100%. Absolutely. And that's where gratitude journaling and just journaling your journey out. So that way, whenever you have these small wins, you can really circle, highlight, asterisk, whatever you want to put next to it to go back and anchor into that.
Yeah.
Because it's so true. Like we kind of, I don't know, to forget. And we just don't really understand how much progress we truly make until we go back and see just how much of a mess we were at in comparison to where we are.
Yeah.
And, you know, That's just the beauty of life. We're always going to experience curveballs and whatever fun things life wants to throw at us. But as long as we have our foundation set on the scriptural reference here, set built upon the rock,
Yeah,
when winds come, it doesn't say that those who do build their foundation on the rock, that the winds won't
yeah,
come. No, they will. It's
yeah,
just we have a different foundation that we've built upon, and that's why
yeah,
we withstand those storms because we have a solidarity of peace down deep that, when you go down 100 feet up top of a storm on a sea, it can look crazy up here, but, 100 feet down, there's an inner calm and inner stillness. And I think that sometimes just helps a person become more resolute and strong and knowing that they can persevere and kind of continue going.
yeah, for
And
sure. So
I
much.
would say some of the four key things, just to wrap it everything up, chronic infection, Lyme involves in that. Lyme doesn't necessarily just mean Borrelia. I could say that, Lyme and Babesia, Bartonella, and some of the other co-infections can be intertwined with Lyme. You want a more complex test. There's oftentimes chronic inflammation that's, heavily involved. That's coming from multiple places, not just one. There's an immune suppression that's leaving you more vulnerable to these other pathogens or these other foes, if you will, these co-infections. And then thinking toxicity. So we really want to think about that bucket, much more work we got to do. And maybe we need some more investigation. You had brought up that mouthpiece, and it's so important. I had unhealed teeth extractions. My wife had unhealed teeth extractions. And most of the time, these are wisdom teeth. You met a doctor whom I interviewed, Dr. Jerry Curatola, phenomenal guy in upstate New York. And he
Right
did
here.
love him. He's such a fun guy. And I was asking him, I said, a lot of people, when they go to their dentist, they can have them swab their saliva and have it looked under a microscope. And I did this for myself and my wife, and we had spirochete bacteria in her mouth. I said, are these opportunistic bacteria that should they be there? Are they there because I've had Lyme? My wife has Lyme. How many of these do you see on average? When did they become problematic? And what should we do to help, clean up that oral garden, that microbiome up in our mouth? And he said, that's a great question. He goes, they become problematic whenever the bacteria go into the spaces where that tooth was pulled and it didn't properly heal up. And that's where we can find people when they go through an eradication of Lyme. The Lyme bacteria hide, which you had made mention earlier, but oftentimes people will think they've gone through a treatment process and then they relapse because the Lyme come back out of their hiding places and they're often staying up there in those areas where they had, even a failed root canal or, like I said, an improperly pulled tooth that didn't heal over the way it should have. And so anybody who's watching, if you've got root canals or any teeth that have been extracted, such as the wisdom teeth, you might want to go back and double check with a biological dentist. And you can check out the IAOMT.org website to find one in your area who does these. That can really be a lot of help to a lot of people's troubles just in of itself, the
Yeah,
infections up here.
yeah, for sure. 70 to 80%. This is actually a CDC statistic. 70 to 80% of all disease begins in the mouth.
Isn't that
Dr.
crazy?
Curatola, yeah, Dr. Curatola was talking about that this weekend. So this is something I picked up on his table. The top 10 sources of chronic inflammation and toxicity found in the mouth. So we're going to be putting a summary of that as a blog article,
Oh, that's
referencing,
awesome.
his work because he's amazing. And he's written an awesome book, the mouth body connection.
Mouth
Sorry,
body connection.
the mouth body connection.
Twister.
Really great book.
Hmm. Really good. There's a couple other dentists out there. Hal Huggins was kind of the pioneer, I guess, of biological dentistry from way back. And there was a cardiologist, Thomas Levy is his name. He wrote a book called The Hidden Epidemic. And he had postulated that I think they were up in Colorado, and he went to go work in Hal Huggins' office. And they had found, I believe the bacteria was called Porphyromonas gingivalis. One of his deceased patients that had died from, I believe, stroke or heart attack had that bacteria circulating in their body. Poor gum health or poor oral health was a contributing factor to their heart disease.
Yeah, absolutely. That's another, we could talk about that all day long. There's lots of things connected to the mouth.
It's
Yeah, go
important
to our
to take
website
health.
too. There's a handout on how to detox your life. It's just a step by step, real easy. Take it little by little. Can't eat the elephant all in one bite kind of thing. So that'll help.
Wellness.com, and you can get that. And I'm
Yeah.
really excited to hear what you have to learn over your weekend there. And I guess we'll pick up hopefully soon again on another video where we can talk about oral health and
Oh,
Teresa,
for
thank you so
sure.
much again.
You're welcome.